Well, as Carrie mentioned, my name is Mario Garner. I'm the president at St. Luke's Health, the Vintage Hospital, located here off of Chasewood Park, right here in our community of Northwest Houston. And this is an external rendering of the hospital. You'll see before us human kindness. If you've driven around the city, you may have seen billboards throughout the various corridors that say, "Hello, human kindness." That is our mantra within St. Luke's Health System, and certainly our mission is to make the healing presence of God known in our world by improving the health of the people we serve, especially those who are vulnerable, while we advance social justice for all. Each day at the Vintage Hospital and throughout our health system, not only here locally with St. Luke's Health, but nationwide through Common Spirit Health, we bring our mission to life each day through people and programs. And throughout the course of the pandemic, we'll talk about today, we've not only made strides toward advancing technology and efficiencies, but more importantly, we've been focusing on our people. This has been a monumental 18 months, not only at this hospital, but I'm sure all of the health systems in Houston can attest to this being a very monumental year. And one of the things that we have to remind ourselves of on a daily basis is that a hospital is not necessarily taking care of people. It's people, the people that we have who are taking care of people. One of the things I'm proud to say is that our hospital is not just an institution, but we are an organism. We are living and breathing people taking care of living and breathing people. And so with that, we are to function like a body, an organism, interconnected, interwoven to advance the mission of our healing ministry. So St. Luke's is committed to a healthier future. Each day, we have learned and continue to learn new things about the pandemic. But most importantly, we are responding to ensure we are not only caring for our patients, but also for our physicians, nurses, and our colleagues, our employees. I'll share with you a few statistics from the Texas State Department of Health Services. Fully vaccinated individuals in the state of Texas has passed the 2 million mark effective yesterday, and our vaccination rate is 43.2%. Actually, I stand corrected. This is Harris County statistics. Fully vaccinated individuals, more than 2 million, at a vaccination rate of 43.2%. However, health experts, according to the State Department of Health Services, says that 75 to 90% of Texans will need to be vaccinated to reach herd immunity. And one interesting thing you will see on these charts is that it's rank ordered actually by the generations. And so for 12 to 15-year-olds, we're right at 20% vaccinated. 16 to 49-year-olds, 43.5% vaccinated. And then we see with our baby boomers and our traditional generationers, 50 and beyond, 67% and 69% roughly, respectively. And so we still have work to do to fill that gap toward herd immunity. And St. Luke's Health System is very proud to have partnered with other health systems in the community and certainly with the State Department of Health Services to help us reach that goal. Where the cases are, you will see over the past 14 days, this bottom row that's highlighted in orange, you will see that over the past 14 days, effective yesterday, there have been about 20,546 reported cases of COVID, with Harris County leading in reported cases. So roughly around 2,419 cases in Harris County that have been reported over the past 14 days, followed by Dallas County. There have been surveys based on HoustonPublicMedia.com, surveys of 140 employers throughout the city of Houston conducted in June of 2021. 87% of Houston employers are encouraging but not currently requiring employees to get vaccinated, while 8% of those surveys said that they're going to make vaccinations a requirement. And then furthermore, 31% of Houston employers plan to fully transition back to the office within the next 3 to 12 months. So I'm sure we can all relate to working from home, working remotely, utilizing Zoom platforms, et cetera. Interestingly, only 31% of employers plan to fully transition back to the office within the next 12 months. Consumer mindsets in post-COVID. The COVID-19 pandemic has highlighted the need to focus on the whole person to address not only medical needs, but also behavioral, social, and economic vulnerabilities within the healthcare system. And we'll touch on this briefly throughout this presentation. This chart speaks to the consumer's voice. There was a two-part survey conducted by SG2, wherein the question was asked, why are consumers delaying healthcare? And then in 2019, the survey focused on cost. And so you'll see in 2019, based on this nationwide survey conducted by SG2, they asked millennials, Gen Xers, baby boomers, and the silent generation, why are you more than likely to delay healthcare because of cost? 32% of millennials said yes, 23% of Gen Xers, yes, baby boomers, 12%, and the silent generation, our seniors, are less likely to delay their healthcare because of cost. Fast forward into a post-COVID survey, the question was asked, based on the trajectory of the pandemic, how likely are you to delay your care? 40 to 45% of millennials said they would delay because of the trajectory of the pandemic. 28 to 33% of Gen Xers, 15 to 18% of baby boomers. So you're seeing as the ages increase, there's less of a propensity to delay, but certainly our millennials and Gen Xers are more than likely to delay, and we've seen they have delayed their health care throughout 2020 due to the trajectory of the pandemic. However, all generations believe that timeliness now matters more than ever. All generations have stated on this survey, also conducted by SG2, that access to care in less than a day is most important to them. So what you see here is at the top chart, what's highlighted in orange, 41% of survey respondents said that they prefer a wait time of no more than 2 hours. 13% said that 2 to 4 hours is appropriate. 28% said that 4+ hours, but in the same day, is most important to them. And then at the bottom of the graph, you'll see in the gray bars that among those who said that seeing a provider or having access to care in less than a day was more important. 75% of Gen Z said that's very important, which are our citizens who were born after the turn of the millennium. Our millennials, 80%, 83% of Gen Xers, and even 82% of boomers and 85% of the silent generation. So we have a commonality that everyone wants to be seen in less than a day, despite the ability or the propensity of us to put off care when we need it. We want it available quickly. And so that means seamless access, personalized experiences, transparency is important. And then we'll talk about the use of digital platforms, which garners more access to our citizens for access to care. And then another component that we've also seen is that across the generations, we are more apt to see advanced providers than equally with physicians. And so there's no longer a reluctance to see advanced providers instead of a physician. If timeliness is important and access is important, and an advanced practitioner is available to see the patient or the consumer, consumers are more readily available now and more readily willing to see advanced providers. Specialists required to support post-COVID-19 symptoms, behavioral health providers for mental health and any other mental side effects that have transpired from the onset of COVID. Cardiology and vascular specialists, endocrinologists, general medicine physicians, hepatologists, liver specialists, infectious disease physicians, nephrologists, neurologists, pulmonologists, and again, vascular. So wide array, clearly, of specialties needed to support the post-COVID consumer, particularly if you've been impacted by COVID personally. But what we're also seeing is that there's going to be a robust outpatient recovery. So based on data that SG2 has provided, you'll see that top blue line speaks to outpatient surgery and where we're projecting outpatient surgeries to grow over the next 15 years. The orange and green line refer to outpatient visits and then also evaluation and management visits, also showing a similar trajectory, a little less than the ambulatory surgery center, but a similar trajectory, about 14% growth between now and 2029 for how we're going to be receiving care in the community. And what's interesting based on SG2 data is we're actually anticipating seeing a decline in ED visits. So more of a transition from the hospital setting into the outpatient setting for access and lower cost of care. This is another illustration that shows what we can anticipate in the years to come. You'll see the home with access to virtual into the physician clinic or the proceduralist office. And then you'll see highlighted there the ambulatory surgery center. ASC means ambulatory surgery center. That's projecting the highest growth out of all of the acute settings and post-acute settings over the next 5 to 10 years, projecting 11% growth in ambulatory surgery center type procedures and access and growth for consumers. And so as we continue to see that, the inpatient side is going to obviously have to focus our efforts on growing and being able to take care of more acute patients and then quickly getting them to the skilled nursing setting and then back to home. So that end-to-end continuum is going to be very important. However, the ambulatory surgery space is where studies are showing that we're going to see the highest growth. Economically, there's an American Rescue Plan that President Biden is putting into place that has really three aspects that are going to relate to healthcare: fighting COVID-19, advocating for public health, and then assisting states and individuals. So within this American Rescue Plan, we're looking at about $46 billion within it to increase COVID-19 testing and tracing, $1.43 billion for the Older Americans Act, including access and vaccination and outreach efforts for older Americans to protect themselves and be preventive in the space of COVID-19. $7.5 billion to create and sustain a public health workforce as we work through what was a pandemic but is likely here with us to stay. How do we continue to study and improve and get to that level of herd immunity that will help us, move into the next phase of how we can manage ourselves and our communities with COVID. And then percentage point increases for states who have not yet expanded in Medicaid. President Biden is advocating to increase our reimbursement rates, particularly in the in Medicaid rates. There will be some advantage for states who have not yet expanded in Medicaid to get some matching through federal assistance so that we can expand healthcare insurance coverage for persons who may be uninsured and are underinsured. And then finally, economically, additional stimulus payments have been paid to citizens who qualify, this time including veterans, to be able to assist in the rebounding from the economic downturn that we saw over the past 18 months. So highlights in all aspects. Thank you for this opportunity, and I look forward to questions at the end of the presentation.
Thank you, Mario. All right, next we will have Scott Davis with HCA. I'll get your slides up here.
Thank you, folks. All right. Well, it's great to be with everybody today. Thank you, Mario, for your comments. Definitely a lot of change as you think about healthcare and where we're at now versus where we were a year ago. And I will, as I go through my presentation today, really give you some highlights on where we're at as a system, give you a little summary of sort of what has happened with COVID, and then talk a little bit about some macroeconomics, job environment, et cetera, to sort of give you a flavor of what we're dealing with in healthcare currently. If you want to go to the next slide there, Bobby. So if you haven't been to HCA Houston Healthcare Northwest recently, I encourage you to stop by for a visit. One of the things I've been most happy with is our efforts with the chamber to continue to enhance our community, and the hospital here has I think done its part to enhance the area around our hospital, not only on the campus directly, but in the immediate area around our hospital. We've added a couple new parking lots, a lot of landscaping, added 2 new helipads for our trauma, our stroke, our cardiac programs, and have really added a lot of lighting and just created a greater ambiance, not only for our community, but for our campus as well. Very proud of that, and proud of the team and the efforts there to really reinvigorate our community. And I look forward to our continued efforts with the chamber to continue to improve the 1960 corridor and the areas around it. Go ahead and go to the next slide, Bobby. So I'm going to talk about 2 things. As I mentioned before, I'll talk about a time of unprecedented change, the things that we're dealing with, the changes that sort of happened during COVID. And then I'll talk a little bit towards the end of sort of how we are working towards becoming a more resilient delivery system. How do we take the lessons we've learned from COVID and incorporate that into healthcare? As Mario said, it was a pandemic that's turned into something that's going to be with us for quite some time, and we need to be ready to continue to be resilient in our delivery of care with that pandemic. Go ahead, next slide, Bobby. So data we got presentation just a little while ago, 585,000 US deaths from COVID, over 3.3 million global deaths. So obviously, this truly was a pandemic. As I said, we are not out of the woods yet, still dealing with it, but it was a tremendous impact on many of our loved ones across our nation, not only in the United States, but across the world. And hopefully we will continue to see a decrease. And the good part is that the deaths have gone down. Vaccinations have helped. It has reduced hospitalizations, reduced deaths. So all good things. But obviously, I think it's important for us to remember just how impactful this COVID pandemic was for our world. Next slide, Bobby. So Mario highlighted this, but just a couple of things that I'll emphasize on this slide. As you see sort of that assisting states and individuals, this package that President Biden did pass did provide a lot of funding, $360 billion for state, local, tribal governments, $170 billion for schools and universities, and then $25 billion to help restaurants and bars. So I think that has been good to see that money put back in our community. Some of the slides I'll share with you talk about the job environment, and we need still a lot of work there. And then I will highlight that we are fully subsidizing COBRA with this plan, which is the benefits for health insurance for individuals that have lost their jobs. That is at least going to continue through September, and we'll see what happens with the job recovery. Obviously, that may need to be extended, but definitely some good support and relief that has come from that plan. Next slide, Bobby. So 3 scenarios. Obviously, I don't want to panic anybody here, but as we sort of reviewed the data, these are the 3 scenarios that could play out for us in the United States. About an 80% likelihood for the good scenario, which would be we get some herd immunity by the end of this summer, obviously primarily via vaccinations. Love to get to the point where we're a 90% or more decline in death rates by June, which we're pretty close to that. We did make some pretty good efforts in the community, and then obviously we want to prevent another large surge with herd immunity. 15% likelihood is that bad scenario where the vaccine rollout continues to stall. We don't get enough folks vaccinated. The new variant that we're dealing with now with the Delta variant continues to surge during the summer, and we get a late summer, early fall surge that could be obviously as impactful as some of our surges last year. And then obviously we had the less likelihood, hopefully really only a 5% likelihood for the ugly scenario, which is the vaccines completely falter. We don't achieve herd immunity in the United States, and we go back to more stringent lockdowns, possible impacts to the economy, and sort of see COVID-19 becoming an endemic disease, again, leading ourselves to overwhelming the hospitals again. And so hopefully we do avoid that ugly scenario. But I think the key message that I think as healthcare providers we want to share is that we're not out of the woods yet. We need to be vigilant, and we got to keep we need to go back to normal. We do need to sort of get with our families and all of that, but we need to be take precautions as we do that. We're not out of the woods yet. Next slide, Bobby. So definitely consumer mindsets have changed. We expect COVID-19 to have a lasting impact on behavior. 41% of adult consumers reported delaying care. Again, 50% of our consumers were still unemployed in late September, who lost their jobs due to COVID-19. 15% of consumers use telehealth to see their doctors compared to below 1%. So you saw that drastic change from going to see telehealth. And then sort of an interesting dynamic relative to chronic conditions. 15% of consumers with a chronic condition did lose insurance coverage due to COVID-19. And then I've got some more statistics to talk about preventative care, but 32% of consumers have skipped routine care, including their annual checkups due to COVID-19. We do expect that to continue for a little bit. Next slide, Bobby. So a couple of things that we think about the long-term impact of COVID-19 on our society. Definitely increased risk of lasting organ damage for folks that did survive COVID-19. Diabetes diagnosis as well at a lot of our COVID-19 survivors. Impacted delayed care. As I said, 41% of our adults delayed care. Vaccinations, not a great statistic, but non-influenza vaccination rates dropped 83% for seniors and 60% for individuals aged 19 to 49. So again, not getting the necessary vaccinations we need. And then diagnostics, 89% fewer breast cancer screenings and 85% fewer colorectal cancer screenings. So definitely concerning, something we need to think about. And then I think the last, or do you think about that, the worst impact is the stress and isolation. 29% increase of heart disease, 32% increase of stroke. And then 53% of Americans have reported their mental health has been negatively impacted by stress and worry over the virus. And then obviously I talked a little bit about our telehealth increase in demand. So definitely some things to think about, things we need to educate the community, encourage them to receive care, and try to move away from deferring care, as has been the case over the last year and a half. Next slide, Bobby. So talk a little bit about, what does that mean? We know that the acuity is higher, patients are more sick because they've deferred care. How do we become a more resilient delivery system? I'll talk about that now. Go ahead, Bobby. So I talked a little bit about unemployed. That is a big impact. It is changing up the payer mix. It is changing up the ability for our individuals to have health insurance, which obviously defers, keeps people from getting care that they need. We are seeing some uptick in jobs, but it is still lagging, and I've got a slide that'll show that. But we're still behind on that. Obviously, Medicaid is not something that Texas really looks at expanding, so we have to get creative in that space. But that is something that the government is trying to do, is expand Medicaid. We do have some mid-year enrollment for the individual market, the funds that folks can buy into if they don't have insurance, but obviously those are expensive. But it is at least something that's open mid-cycle for people to get enrolled if they've lost health insurance. Next slide, Bobby. So talking about access to low-cost insurance, I mentioned the Medicaid. The exchanges are going to be important. As I mentioned, that special enrollment period that goes through August 15th. We are trying to cap the individual markets, the contribution of household income, trying to make that more affordable. And then you can see that map there of the United States does show the states that are considering expanding coverage for Medicaid to allow us to deal with the uninsured mix across our communities. And then you can see the green states that are having to evaluate alternative options, Texas being one of those. All right, next slide, Bobby. So I talked about the Houston market job recovery. This is sort of projection of what it's going to look like for job recovery in the Houston area. Anticipate likely taking 2 to 4 years in order for us to get our jobs back. You can see at the start of that slide how many jobs we lost in March, September, even through March of 21. And we are slowly getting back to normal. The average case projection is about 50,000 jobs per year recovery. Best case, 100,000 jobs per year. So, we could be anywhere from end of 2022 to the first quarter of 2025 before we recover in the Houston market relative to our job recovery. So we're going to have to be more resilient, I think, not only as a healthcare system, but as a community as we recover, and hopefully we can get back sooner than later, but definitely an impact on the job market. Go ahead, next slide, Bobby. And this sort of shows you the areas. This is the biggest impact. Construction, accommodation, food services, professional business services, manufacturing are the biggest job losses. But you can see it hit almost every industry, and it's going to take us some time to recover in that area. But we do anticipate that we'll get back, but it's going to take us some time. Next slide, Bobby. Medicare spending, as we know, we got the baby boomers coming out. You can see that huge increase of our Medicare spending and the population, right? We're going to have Medicare eligible seniors will grow from 17% to 22%. You can see that Medicare dollar is continuing to grow. And that's going to be something that's going to put a whole lot of pressure not only on the federal government, but our healthcare systems, as well as our Medicare beneficiaries. So something to continue to keep an eye out as we're going to need some changes relative to Medicare. And then next slide, Bobby. Telehealth, I talked about telehealth. You saw that artificial peak with telehealth, and it has declined, but we do anticipate telehealth to be a long-term, not necessarily a replacement, but something that is going to augment care in the community. And then next slide, Bobby, I have some statistics on that. The categories you can see, mental health, 67% of our telehealth business across the nation, but it's growing. Internal medicine, gastroenterology, radiation oncology. So it used to be mental health was really the only thing we saw in telehealth, and now we've seen it in almost every service line, and it will continue to grow. And I think as part of our resiliency and getting people to get the health care they need, but making it convenient and as accessible as we can, as Mario mentioned. Next slide, Bobby. And then last but not least, the last slide for me is probably one of our biggest concern, and that's going to be clinical labor. Not only sort of individuals that have accelerated their retirement due to COVID-19, interruptions of education and clinical rotations from last year. It's going to take us a lot of time to catch back up. I think we're all getting creative as systems. I'm proud of the work I think all of us are doing in backfilling that. We've got a lot of new folks entering the market, a lot of new opportunities to grow. HCA has actually started its own nursing school, and we are investing heavily in nursing resources to try to close that gap as good as we can. But definitely, as you think about healthcare and where we're thinking about the healthcare system, we would definitely want to encourage our community and people coming out of school to encourage healthcare as a career. There's going to be a lot of opportunity in really every aspect of healthcare, and we're hopeful that more folks will continue to join us in that workforce. So I mean, a lot of statistics, a lot of changes going on with healthcare. But as I said, I think we're well positioned as an organization, well positioned, I think, with all of the providers here in the Houston market to weather this continued storm that will happen for quite some time. But obviously, it's definitely been a change for all of us. Thanks, Bobby.
Thank you, Scott. Keith, let me pull up your slides, and it'll be all you.
All right, great. While you're pulling up my slides, I'll just go ahead and express our appreciation to be here, Bobby. Thank you for hosting us. Carrie, I'd like to thank you for your comments at the beginning, expressing appreciation for the healthcare providers. I'll tell you that has been the thing that has largely sustained us healthcare providers during COVID. It has absolutely been the toughest years of our careers, but I think also the proudest. And a lot of that has come literally with the connections that we have with the community, caring for the community, but also hearing a lot of encouraging words from the community as we have cared for everyone, and the gratitude expressed back. It has really made a big difference for our healthcare providers. It's great to be here with Scott and Mario. So kind of get into the first slide. I'm going to speak. We really tried to not make this all about COVID, but as we talked to Bobby, COVID unfortunately still is very relevant to us. So I'm going to talk a little bit about being the first healthcare organization in the nation to be committed to 100% of our employees being vaccinated. Talk a little bit about the Delta variant, and then also talk about the innovations that have come about during COVID and how that will benefit healthcare in the future. So next slide. This is a little bit just some of our trends during COVID. You see Actually, that first red line is when COVID started. The second red line was our second surge of COVID that happened last summer. And then the third red line is kind of the January, February surge that we've had. You see there, the blue line is our emergency room visits, and the green line are our admissions, but also a factor for our outpatient business. So you can see the dips that we all took when we had COVID first hit and the surges, but look where we're coming now. So it definitely speaks to patients and consumers being more comfortable with healthcare. And obviously, these are our volumes here at Houston Methodist. So we have certainly come back strong and even much stronger than where we were pre-COVID. Next slide. A little bit about our commitment to being 100% vaccinated. We in healthcare, we take the Hippocratic Oath, and that is first and foremost to do no harm. That is the oath of our ethics and what we believe is our moral obligation. Also, coupled with the fact that we're a faith-based organization, we believe that the vaccine is key to lowering incidence in our community, and the vaccine decreases mortality and hospitalizations. And for us, it's certainly a component of leading medicine in the communities in which we serve. Next slide. A little bit about our numbers of becoming 100% vaccinated. We're very proud to have over 99% of our employees joining us in that effort, and also the same with our medical staff. You see here on this graph I had over 1,000 physicians on our medical staff here at Houston Methodist Willowbrook. 11 of those were also granted either religious or health exemptions from the vaccine. We only had 2 physicians that chose not to be vaccinated out of all that, and 32 employees. And what's interesting in the bottom right-hand corner are the number of employees that I have welcomed in May and June. These do not include our July numbers of employees coming to us. And when I've asked them about their feelings of joining an organization that is committed to be 100% vaccinated, a lot of comments about that's why I'm here. I'm proud to join an organization that's committed to that. So have definitely recruited far beyond the few employees we lost as a commitment of being 100% vaccinated. Next slide. And also wanted to share with you, this is really hot off the press out of one of our Becker's Healthcare magazine from last year, the systems across the nation that have now joined our lead in being committed to 100% of their employees being vaccinated. So you see New York Presbyterian with 48,000 employees, the Maryland Hospital Association with 60 hospitals, altogether almost 650,000 employees across 23 healthcare systems being committed to being vaccinated in order to ensure the safety of its patients. Next slide. This is also, I wanted to talk a little bit about the Delta variant. The graph at the bottom, kind of the axis going across is the rate that each component of COVID is contagious. So you see that the Delta variant is quite a bit more contagious than the first waves of COVID. And then also going up that y-axis there is the percent of our population that needs to be either immunized or immune from COVID in order to reach what we would call herd immunity. So it takes more being vaccinated with Delta, about 80 plus. And as you saw in Mario's, I think Houston is really right around 50% now. So we still have some work to do. So I think we as community leaders want to continue to come together and really promote the need to become vaccinated. We've still got work to do before we truly become herd immunity in our community. Next slide. Also wanted to share and address the innovations that have come about as a result of COVID. Next slide. These are things that we have certainly put in place at Houston Methodist. One is using virtual technology, integrating innovative clinical solutions to provide advanced critical care. Many of you all have taken advantage of and experienced virtual office visits. That has become incredibly beneficial across all healthcare systems. Another thing that we put in place right as COVID began here at Houston Methodist Willowbrook is virtual ICU. And so that is the continuous remote monitoring of ICU patients, really bringing in highly trained specialists. So ICU physicians that maybe have expertise in pulmonary or cardiology and various, and they're actually monitoring patients remotely in addition to the hospitalists and the intensivists that are in ICU in order to ensure high quality of care. Virtual telerounding is also something that we put in place with the use of iPads and smartphones and workstations that allows infectious disease physicians, psychiatrists, and so forth, different types of specialty to come to the bedside and do that virtually in order to ensure care. And then the other thing which will definitely stay with us is virtual registration. So a lot more ease in signing consent forms, updating demographics, reviewing insurance, estimated payment information, and submit payments all electronically, which makes the whole registration process much easier for the patient. Next slide. Another thing that we're very excited about, one of the things we've put in place at Houston Methodist across our system are echo dots in all patients' rooms, which allows the patient to use voice command, multilingual as well, to ask questions about medication and so forth. And then the other thing that we're particularly excited about, and this is in pilot phase right now, is everybody's experience over the last decade for sure as the computer age has continued to advance in healthcare, feeling that has impacted negatively the relationship between the patient and the physician, because the physician is actually spending more time documenting and on the computer. Well, we have now we're piloting actually an interactive microphone that is always picking up keywords that allows the physician to not be on the computer during the time with the patient, because it is literally picking up keywords and creating dictation that the doctor can later on go clean up for the progress notes for the patient, and the physician is able to stay focused on talking with the patient, more eye contact, and being ever present. So that is certainly something that is advanced during COVID, and we know will continue to advance as we move forward with delivering healthcare. Next slide. And finally, the other things that we've put in place during COVID is My Methodist Patient Tablet. It is a system-wide patient empowerment initiative. It is committed to putting an iPad in every patient room in our hospitals, which allows patients to stay connected with family and friends. They can also order meals on their iPad, so it provides lots of variability in use. And then also to view MyChart, which is the electronic medical record for tests and treatments, and educational material for the patients. This has been really a great thing during COVID, because especially during our COVID patients, with much less traffic coming in and out of the room, it has allowed them to stay interactive and have more connectivity with their loved ones and also their healthcare providers. We're also very excited about a new program that we put into place during COVID, and that is what we call our Meds to Bed program. So many of you, whether you've been in the hospital or have had family members or loved ones, what do you do when you get discharged? You go to the pharmacy and pick up all your meds before you go home. And so we now have an outpatient pharmacy attached to our hospital that will deliver those meds to the patient's room before they leave, and that they're able to go straight home. And so we're very excited about that. And we know that will just continue to expand as we continue. And then also wayfinding. Wayfinding has become more digital and easier to navigate And so just, we all have big campuses, complex campuses. So being able to offer that is a great innovation that I know will sustain and just grow as we continue to deliver healthcare. Next slide. I think that's actually all I have. So pleased to present, and we'll turn it back over to you, Bobby. Bobby, you're muted.
Here we go. Sorry, guys. All right. Thank you. Thank you, Keith, Mario, Scott. Very good. Great information. So we have a few minutes left. We're going to stop this thing at 1. We have a few minutes for Q&A. If you have questions for any of our panelists, please enter that into the Q&A section. If not assigned, I will assign a question to one of our panelists to answer. And this first one is from Brian, and this one is for you, Keith. Is the med-to-bed program at an extra cost to the hospital?
It is. It's an extra cost to the hospital. It is because it's a separate outpatient pharmacy. Certainly, we've made the investment in that. It is an extra cost to the hospital, but not passed to the patient any more than they would have out of pocket if they were just to go to a regular pharmacy.
Okay, thank you. This next question is both for Mario and Scott. The question is, do St. Luke's and HCA have any plans to also require COVID-19 vaccinations for employees?
Right now, within our health system, we're requiring attestation. And so certainly we strongly encourage, and we've offered the vaccination to all of our employees. We're requiring an attestation right now, and we'll be able to clearly delineate who has been vaccinated versus other. And while the EUA is still in effect, once we get determination from the FDA that the EUA is lifted, there'll be more discussions around our requirement, our expectation to require it.
And as far as HCA, we're definitely a very strong, employee rights, let the employees make the decision, but we have no plans to mandate currently. However, one of the reasons we haven't had to do that or consider a mandate is we've had a very high acceptance rates of getting the vaccine for our employee base. So it hasn't been something that we felt like we haven't received enough. We haven't had enough participants to need to move that direction. So been a very good voluntary response rate from our physicians as well as our employees to get vaccinated.
One of the things that we continue to do, and I'm sure this could be echoed across the board, is that we continue to ask the appropriate questions, temperature screen, and provide masks, and require social distancing for any and everyone who comes into the facility to maintain the safety of our colleagues, visitors, and patients.
All right, here's a question for Keith. Keith, how can I find out which insurance companies cover Methodist doctors? My current company has just notified me that they are no longer accepting my Methodist PCP.
No longer accepting their Methodist PCP. Okay. So our website certainly has that information. And then the other thing that I would do is feel free to call our hospital and talk to our patient access area for specifics around that. And if that doesn't get you there, call me.
There it is. Call Keith. Next question. I'm going to assign this one to Scott. With supply chains being strained, have any of the hospitals had issues with inventory and supplies?
Yeah, I think right now, I don't know that there's any industry in the world that hasn't had some issues with supplies. I think we've been very fortunate, and I think Mario and Keith would probably be able to answer the question the same way. All our organizations have a fairly large infrastructure, so we're not small community hospitals or rural hospitals. So we have a fairly large supply chain infrastructure, and that has allowed us to continue to obtain the mission critical items that we need. There's been some delays. You can guess we've ordered ahead and, tried to increase our par level so that we can accommodate shortages that do come up. So there are shortages. But as said, we've been able to address most of the mission critical items and been able to take care of the needs. I think this is going to be ongoing, not only for healthcare, but for other industries for quite some time, at least relative to delay, just because there aren't as many resources available. Production's been delayed because plants haven't been operating, et cetera. But really most mission critical items been able to address, and I think we'll be able to do that long term through the infrastructures that I said. I'm sure Keith and Mario have the same type of infrastructure that we have with HCA.
Excellent. Thank you, Scott. Mario, I'm going to give this one to you.
Okay.
As we are seeing, our younger generation or population is less likely to get vaccinated. So the question is, how can we encourage our students about vaccination, and is there anything else we can do to help our healthcare and community?
Absolutely. I think, through school health, obviously, with school health nurses that are in the communities, linkages with primary care physicians like pediatricians and family medicine providers in the community. It's going to be very important, and other health educators even. It's going to be very important that we, educate our young students and young citizens around the importance of the vaccination through evidence-based, results that, can be easily understood at their level. And then again, I think as we open up the door for more access through virtual medicine, telemedicine, et cetera, to inform the parents, I think we'll see an increase in vaccination rates for students and young citizens. So, multi-pronged approach, but I think education is going to be important. Access, as we talked about, is going to be equally important. And then, through our school systems, et cetera, partnering with local hospital providers, we stand ready to support it in any way, shape, or form. In fact, we're very happy to partner with Tomball ISD and Spring ISD to offer vaccinations to teachers this year.
Okay, thank you, Mario. All right, this question is going to be for Scott. What measures should businesses back in office and schools returning in person maintain, such as masks, and how long should they continue these measures?
That's a great question. So, and you all can guess, as a healthcare provider, right, we are still wearing masks, being an example of wearing masks in the community. One of the things with the vaccine is that the vaccine still does allow COVID-19 to be passed, right? So that is with the vaccine. However, it substantially, if not completely, reduces the risk of hospitalization. And so I think as you think about best practices, obviously, as you consider vaccination requirements for your employees, that is definitely something that I would think about as an employer, is trying to do that vaccination. If you don't require the vaccination, at least know who's vaccinated and who's not. That can allow you to put some best practices in place for how you separate employees. Definitely would encourage social distancing, encourage mask wearing where people can be social distance. That's how this thing is spread. It's spread through airborne transmission. So the more we can reduce that chance for people to be together and be close together, especially without masks and indoors, that's the highest risk. So where you can avoid those settings in your business environment, where getting people really close for 10 to 15 minutes or more in a room indoors, that's what you want to try to avoid.
Great. All right, we're coming up on the hour, and I'm going to finish with this last question. I'm going to have each of you quickly take a turn at it, because I think this is a great question to end on. We'll start with you, Keith, then we'll go to Mario, and then we'll go to Scott. And the question is, thank you for your excellent presentation. Out of all the innovations born out of this pandemic, what are you most proud of and why?
All right, well, from a quality perspective, I'm very excited about our virtual ICU, because I think that's very innovative. Being able to bring that super high level of physician specialty to our ICU beds is fantastic. But what I'm most excited about for our patients and consumer is the experience for an inpatient when they're in their patient bed, being able to have that Echo Dot there and their iPad, which allows them access to ask questions, connect with our nursing staff, connect with their loved ones at home, being able to get their meds to beds and so forth. And I think being able to have an iPad where we'll just continue to add components to that and improve the patient experience is very excited about that.
Thanks, Keith. Mario?
I would say virtual health and the advancement of virtual health here at St. Luke's Vintage has also been what I'm most proud of technologically. But what I'm really most proud of is our colleagues and their resilience. Throughout this 18-month period, we have had colleagues who are truly committed to the mission, and that is making the healing presence of God known. We pray with our patients. Every patient who is an inpatient at the hospital and even in our emergency department are visited by a leader every day, where we check on you to make sure that we're meeting your needs. We're rounding on you on an hourly basis. You have what you need. You understand your medications. You understand your discharge plan, et cetera. And because of that, the hospital, even in spite of the stay-at-home mandates and the COVID laws, we have, continued to be able to extend our ministry into the community. And I'm very proud that we've gotten a lot of commendations from patients who've been here, even in the height of the pandemic, who have raved about their experience and that they feel our mission at work. So that's what I'm most proud of.
Thank you, Mario. Good answer.
I would say for hospitals, similar to what Keith mentioned, the innovations around the patient accessibility, how they're able to navigate and when they're in the hospital, not only in the hospital, but also out of the hospital, and registration, and just everything being as easy and accessible as it can be. It's tough to navigate a hospital, and I think that is one of the biggest innovations. But I think for me, the thing we're most proud of is the quality of our organization through COVID and having more acute patients and really sicker than we've had before, and everything that goes along with that. Our mortality rate and our complication rate is the best it's ever been. It's one of the best in the nation. And I think about the innovations and the resiliency in figuring out how to take care of patients that were very sick during the pandemic and still are doing that now. I'm very proud to see that, and I think Mario and Keith would probably reflect the same thing, that it's been wonderful to see the quality of care that our organizations have been able to maintain through innovation and through resilience through a very difficult pandemic and really a very high acuity of patients.
Thanks, gentlemen. I want to say in closing, and speaking from personal experience with what being in the hospital is, and you all have touched on this in one form or another, is not just a science and technology experience, but it's a human experience, and there's a spiritual experience. And all of those elements are elevated and heightened when you are receiving services from your local hospitals. And that's an art form that I have seen nowhere else. And so I want to congratulate all of you for doing such a good job in your hospitals. Thank you very much. Thank you for doing this today. And be safe. And last thing, everyone who's here, thank you for coming. This event is being recorded and it will be posted on our website. You can easily find it at our website or on our YouTube channel. So thank you, everybody. Have a great day and be safe.
Thank you.